to involve patients between 50 to 60. This is also a danger period because a lot of patients will be undergoing menopause at about their 50s. And sometimes when they undergo menopause, they have irregular menses. But when they have irregular menses, it can also be because of uterine cancers. I had a patient who delayed her diagnosis of uterine cancer for about 2 to 3 years. Because she was 52, she was having heavy bleeding, heavy menstrual bleeding. She waited until she was 54 before she was saying that, hey, there's something wrong. My menses is getting more instead of getting less. So uterine cancer is quite common in Singapore, and I would say that if patients are experiencing problems during their menopause period with abnormal bleeding, please see a doctor. All right. The second most common female cancers, I'm talking about female cancers as in like uterine cancer, ovarian cancer, and cervical cancer. Ovarian cancer is the 5th in Singapore, and this is also known as a silent killer because ovarian cancer tend to be diagnosed in the later stages. Ovarian cancer, unlike uterine cancer, it does not cause bleeding. In fact, it causes things like bloatedness, increased bladder urgency because the ovaries are at the side, and if it swells, it will start pressing on things, all right, and it will start pressing on your intestine and can cause bloatedness. A lot of patients get diagnosed a little bit late for ovarian cancer is because they see other specialties. For example, they start seeing their GP for urine infection, they see a colorectal because of intestinal problem like constipation. But actually what they have is an ovarian growth that's causing problems. So 75% of ovarian cancers are diagnosed at stage 3 to 4. Cervical cancer is number 10 on the list. We expect that to drop below the list, all right? But that doesn't mean that it's not an important cancer. Because cervical cancer is important because it affects patients who are younger, and it's also the most preventable cancer among women. So the background risk of a lady having uterine cancer is 1 in 200, ovarian cancer is 1 in 83, cervical cancer is low, and a lot of times the incidence of cervical cancer in a community will depend on our practices. Because we know that cervical cancer is due to the spread of a virus. This virus is known as human papillomavirus, and this virus is spread through sexual intercourse. So a lot of times the cervical cancer incidence in the community is based on the sexual practices in the community and the prevalence of this particular virus.